think one of the most important elements that we have to factor into our work is really establishing strong partnerships with throughout the public health community. And I think with the Affordable Care Act, what that's done is it's increased the number of potential partners that we have that we can work with. I think because of the Affordable Care Act, hospitals and healthcare systems are expected to play a role in population health. And so because of that, they're more engaged, and we can more readily talk with them about our work that's similar and has the same priorities or the same goals. I guess one of the other things that I would say is a key element to improving the health of communities is really having access to data to help us to identify what those priority health concerns are, and also which communities or which populations have the greatest needs. I think we know now that with limited resources, government can't do it all. And so we really need to partner with others to help expand our work, but also be very directed and targeted in terms of whose problems we're trying to address or whose needs we're trying to address. And so really doing focused efforts to identify who is at greatest risk, who needs the most help, will help us to make sure that our limited resources are used well. The third element that I think is really important to be able to help address the health of communities is having engagement of your local leaders. So mayor, our local aldermen, those leaders can help us to really make sure that we're able to engage appropriate partners, whether it's hospital systems or other city agencies, to make sure that our work is well coordinated. Just in the past year, I think public health was, it was necessary for public health to really engage healthcare and hospital systems specifically as we prepared for a potential Ebola case. And so last year, many months of last year and this year were spent with us, the health department, working closely with hospitals throughout the city of Chicago to develop systems for making sure that patients who were suspected of having Ebola could get the care that they needed without putting the hospital's employees at risk. And so we were able to establish a partnership with 4 hospitals within the city of Chicago to create a network that could provide that care to those individuals. And I think that is actually serving as a great foundation for some additional work that we're doing with hospitals throughout the city and throughout the county. We're in the process of working on hospital collaboratives with over 20 hospitals to do both community health needs assessments in coordination, but also to look at priority health concerns that we can work together on so that our resources are pooled and our attention is pooled, and we're able to really address these community health needs and community health priorities in a coordinated way. I think local public health and state level public health are looking for opportunities to engage with healthcare systems and hospitals without, I feel like with this limited resources that we have, we really have to pool our efforts so that we're doing things in complementary ways. We don't want to be redundant, we don't want to be duplicative, and we want to be doing things that are appropriate. And so if we work together, we're more likely to do that. I think that's a great question. I'm not sure in every local health department or state health department there are different entities within them that are seeking relationship building with hospitals or healthcare systems. I think it's really important for hospital executives to reach out to public health leadership, because it's at that level that we're thinking about these kinds of partnerships, and many of them are new and haven't really been supported in terms of programmatic support. So really going to leadership and engaging in conversations regarding what ways there are, how we can coordinate and how we can collaborate is really a good idea.